This video will introduce you to the OMM technique known as the prone thoracic perpendicular stretch. Now this technique is used to free up the paravertebral musculature and the paravertebral fascial connections. It also can be used to treat rib dysfunctions in the thoracic region. Now to do this technique you want to stand on the opposite side of the side you're treating. So I'm going to treat the patient's right side, so I'm standing on the patient's left. You'll use two hands, and it's called the prone thoracic perpendicular stretch because of the way you'll be working. So we're going to be working perpendicularly, meaning this way, to the spine. So the spine runs longitudinally in the patient. We'll be working perpendicularly to that spine, meaning we'll be working in this general direction, away from the spine. There's another technique known as the prone thoracic parallel stretch, which you'll be working in the same direction as that spine. However, in this case, we're working perpendicular to it. You'll use two hands, and your bottom hand will be known as the listening hand. Now this hand is listening, for lack of a better term, trying to figure out and trying to hear or trying to feel fascial release. Meaning you're trying to feel the tissues underneath that hand release. So this hand is not really applying any pressure. It's your up hand, or the other hand, your force hand, that'll be applying pressure through the listening hand. So my right hand is my listening hand, my left hand is the one that's going to be applying the pressure. Now you want to start with your Thenar Eminence, basically the base of your thumb and your whole, almost the part of your hand closest to your wrist. And you want to work right along that paravertebral musculature, meaning you find those spinous processes or those bumps along the patient's spine, and you want to move just laterally to that. And then you want to work your way out. And so you do this just kind of in a rhythmic motion, maybe hold for a little release up and down the patient's spine. So this is the prone thoracic perpendicular stretch. Working in that thoracic region. My bottom hand is just listening, trying to feel for tissue that's caught up, tissue that doesn't feel right, maybe a somatic dysfunction, maybe a rib dysfunction. And the up hand, my left hand, is the one that's applying the pressure down to the patient's musculature. Again, you want to make sure that your Thenar Eminence, or the base of your hand, is just right next to those spinous processes. You can slow it up a little bit, maybe for a 3 count, to really appreciate the freeing up of that musculature as you do this. As you do it, you'll be able to feel that these tissues will become more pliable, easier to push. Or you can go a little bit faster and really work your way up and down that spine. And this is the prone thoracic perpendicular stretch.